If you've been told that you have bone-on-bone knee pain and are wondering what you can do, join us today to find out whether exercises help or you need to go under the knife.
Hey, it's Coach E here from Precision Movement.
Dr. B, Chief Medical Officer.
And today we're going to talk to you about bone-on-bone knee pain. So bone-on-bone knee pain. I'm going to ask Doc a bunch of questions. We were talking about this before we shot this video just to get a little bit prepared. And she's got some insights I've never heard about before. So if you've got bone-on-bone knee pain, you definitely want to listen to what Dr. B has to say. And then after that, I'm going to take you through some exercises that I think will be helpful. But first off, what is bone-on-bone knee pain?
Well, bone-on-bone knee pain occurs when you lose the articular cartilage that coats the end of our bones. So normally we have cartilage that coats each of these joint surfaces, which allows the joint to move in a frictionless, smooth fashion. Bone on bone means that you've actually lost the articular cartilage. And the way that I look at bone on bone is how many of the compartments of the knee it affects. So it could affect just the patellofemoral compartment, that's one. It could affect the medial or inside compartment of the knee or the lateral compartment of the knee. And the more compartments that are involved, the more severe your arthritis.
Okay, so what's the term chondromalacia patella? What does that describe? Because a lot of people say they have that, they've been diagnosed with that. So what is that all about?
So chondromalacia patella is is a condition that affects the articular cartilage of the kneecap. And if you don't do anything to change how you're loading your kneecap, you eventually can have bone-on-bone arthritis underneath your kneecap. So chondromalacia can be a precursor to bone-on-bone arthritis under the kneecap.
Okay, so another question I get pretty common is, does a bone-on-bone diagnosis mean you need surgery?
And the answer to that is it depends. It depends on how many compartments are affected. I have a lot of patients who have bone-on-bone arthritis on the inside compartment of their knee and underneath their kneecap, and they're still really active. They're out playing tennis, swimming, cycling, but they definitely do have ongoing symptoms, but they've learned to kind of manage those symptoms. So I think that the answer is if you have bone-on-bone arthritis and you cannot control the symptoms to enjoy the quality of your life, then a total joint replacement is a very effective solution.
Mm-hmm. Okay, and then let's see here, what are the treatment options for bone-on-bone knee problems? So somebody goes to the doctor, what are the typical treatment options, and then what do you think about those?
So if you have bone-on-bone, you're in a bit of a pickle because we can't actually put cartilage back on the joint. So the next steps then are to control inflammation, ice, anti-inflammatory medication. Then often you'll be offered injections, PRP, stem cell injections. And
Synvisc, is that something?
Synvisc is another one.
Yeah.
And these can help to control inflammation. Synvisc in particular, or cortisone. You need to be careful about having multiple injections into the joint, in my opinion, and particularly if you're thinking about having a joint replacement. And for me, stem cells are not really a great option. You're not going to grow our normal articular cartilage into the joint. So I wouldn't recommend those. Cortisone used judiciously can be effective.
And what does that mean, judiciously? How often, or how would you use that?
As rarely as possible, but let's say you've got an important event coming up, a wedding, you're going on a trip, and you've done something and your knee's blown up and you can't walk and you're really struggling. And you've been doing your exercises, but you've had a blow up of your knee. A cortisone injection to try and decrease inflammation, to kind of get you through a few weeks and get you back on track with your exercises is reasonable. But having an injection of cortisone every 4 to 6 months to manage your symptoms, in my opinion, is not a good way of going.
Why is that?
Well, eventually you may end up with a joint replacement, and if you have all of these injections, you're not fixing the root cause. You're decreasing inflammation and pain, but you're not putting cartilage back on the bone. And studies have been done looking at patients with joint replacements after multiple injections, and they've got an increased number of complications, particularly infection. We're paranoid about infection as orthopedic surgeons.
Okay. And the last question that we get commonly about bone-on-bone knee pain is, should people with bone-on-bone use a knee brace?
I have used knee braces very effectively for people who want to be really active. What happens if you have bone-on-bone arthritis is that the joint collapses because there's no further space where the cartilage used to be. So there's normally a ligament that goes on the inside of the knee. And when you lose the cartilage, that ligament will lose its normal tension. So it's hard to compensate for that with just muscle strength alone. So if you're going to play a sport that requires changes in directions and stops and starts, getting an unloader knee brace to help protect the ligament and the joint can be very, very effective.
Okay. And we're going to get to some exercises, but before we do, I know that some people are afraid of exercising if they have bone-on-bone. So can you maybe talk about that a little bit and give people some info and some guidance on, when exercise is okay and what to look for when you are exercising?
So I encourage everybody to do isometric exercises. So that means that you're having the joint in one position and you're contracting the muscles. This is excellent for pain relief and will help you to control the movement of the joint so that you're not overloading it so significantly. So isometrics, I'm a huge fan of. You have to be a little bit careful about exercising when you have bone-on-bone arthritis if you can't maintain proper alignment of the joint and the proper movement pattern. So if you're having to compensate too much, or if you're getting a sharp pain, or if your knee is really blowing up and swelling, those are all messages that this isn't the right exercise for you. And so exercising to maintain your mobility, to keep the muscles turned on as best you can, I think is ideal. You're not going to make this knee perfect because we can't put the cartilage back on the end of the bone. Focusing on the joints above and below, I think, is super beneficial because you can take the pressure off the bone-on-bone area. So exercising using common sense isn't going to make you perfect, but it'll prevent you from deteriorating. And if you need surgery, it's going to help you recover from the joint replacement so much more effectively.
Right on. So that's what we're going to get into now. We're going to go through a number of different exercises, and I'm going to put particular focus on those that will take load off the knee. We're going to strengthen the knee, but we're going to go through some exercises and some movements. I'm going to get you to focus on certain muscles in the hip, in the foot, so that the knee has to do less work. So, Doc, thanks a lot for sharing your wisdom, and let's get moving.
Awesome.
We're going to go through 5 exercises to strengthen the knees, but really get the feet and the ankles and the hips stronger and integrated into a pattern to take load off of the knees. So we want stronger knee muscles to support the knee directly, but we want to decrease the forces that have to go through the knee that need to be absorbed by the knee muscles, so there's less forces going through there by working the foot and the hips. So to start off, we're going to release some tension in the muscles. One of my favorite techniques, active self-myofascial release for the quads or the anterior thigh. So you need a foam roller for this, and you start just above the kneecap, and you roll slowly as you bring your heel to your butt. So this lengthens, it stretches the quads, and it can break up any adhesions, trigger points, and that kind of thing that could be restricting the quadriceps from their full motion and causing excess tension on the knees, the kneecap, and the knees in general. So the key here is matching the rhythm. As I roll, I bring my heel to my butt, and that lengthens the quadriceps, shuts them off, and gets you deeper into that muscle. And if you hit any hot spots, and if you've never rolled before, you'll hit one, you'll be like, oh, that's painful. You'll tend to tense up. Try to pause there for a second, breathe. And on the exhale, try to relax and melt the muscle over the roller and then continue on your merry way. For this technique, do it for 1 to 2 minutes per side. You'll start off doing it a little bit longer. You'll be a little slower. You'll have to pause more, so schedule in 2 minutes. But after doing it daily for 2 weeks, you can drop down to every other day or 3 days a week for another couple weeks. And then after that, drop down to 1 or 2 times a week. And that'll help you to maintain good tissue pliability and good quality of the quads to decrease the pressure and the forces that go through the knees. The next exercise I'd like to teach you is something that we call quad ramping. So quad ramping is learning how to gradually increase the amount of tension that goes through the quads. And it's an isometric technique, and that's one that Dr. B mentioned. She loves isometrics. So it focuses on and activates the quads, but you also get the hamstrings activated too. And this can help to keep the knee feeling better. For this, you need your leg on a roller or a pillow or something. Just prop it up so that your knee is slightly bent. And from there, the ramping is the gradually ramping up of activation of the quads. Now, this might be difficult at first. You'll have poor control, especially if the VMO. It happens to a lot of people. Don't fret, practice it, and you will get better. So what you want to do is over 30 seconds, you ramp it from 0 up until 100, let's say, or as high as you can go without causing any undue pain. So we'll start, and I'm just going to slowly, gradually ramp it up. You can't see anything going on from your perspective. And you just want to watch a stopwatch. I mean, I'm doing it right here with you. In terms of timing, I'm ramping up, focusing on getting the quads active, VMO especially. I got about 10 seconds left, so I'm almost at the end, ramping it up. 5 more seconds, keep ramping. And then I hold right there. Whatever level I achieved, I hold for 10 seconds. Breathing naturally. And then I'm going to ramp it down over 20 seconds. So again, gradually releasing the muscle. 5 degrees every time, 5% each time, each little block there. Slowly, slowly. For 20 seconds. And then I'm off and let it go. And you take 5 seconds, then you do it again. For this technique, you want to do 1 to 2 sets for 3 reps on each side. So do all 3 reps on one side, go to the other side. That's 1 set on each, and then do it again. That's 2 sets on each. Start off with 1 set and work your way up to 2 sets, and that'll help you to build a little bit more endurance in those quadriceps, but most importantly, help you to develop that control of the quadriceps to keep your knee nice and stable throughout any motions that you go through. The next exercise is called the short and the skinny foot. So we want to make the foot skinnier and we want to make the foot shorter. What we're focusing on is pressure through this area of the foot, the metatarsals, the bone underneath each toe. We want to keep pressure through the ground, through the foot into the ground, through that area. So to start off with this technique, another popular technique that we teach all the time, you can spread out your toes. If you can't do it actively, just kind of pull them, spread them out, and that'll help you to get that short foot. From there, you got a little metatarsal pressure, so you bring your body weight forward, and we're working one at a time, and then you think about keeping the pressure, making the foot skinny, and then pulling the metatarsals towards the heel. And you might be able to, if you're doing it on a mat, you might be able to feel the mat kind of pulling in towards your heel. That's good. Hold it for about 5 seconds, and then you gradually release. And then you spread out again, make the foot short and skinny. So skinny, short, pulling through the metatarsals, keeping pressure even on the big toe and the little toe metatarsal, and not over curling your toes. Holding it for 5 seconds, you relax, and then you reset, and you do it again. Make sure you have a little bit of body weight on that, because that'll help to integrate the pattern so that we can bring it into movements of everyday life. The next technique I'd like to share with you is called the Slumpy Psoas Activator. This is one of our unique exercises, and it's designed to get the psoas muscle, which goes from here to here approximately, fired up and active. And it's one of the hip flexor muscles. It does this, lifts the foot off the ground, so it flexes the hip. And it's often sleepy and weak in people because of all the sitting that we do. So we're going to fire this up. And the reason why we're using it for bone-on-bone knee pain is because when this muscle doesn't fire up, another muscle has to compensate to do the job of hip flexion. And one of those muscles is called the rectus femoris. It's one of the quad muscles. It goes right down here, inserts onto the kneecap. And if it's doing more work than it should, it's going to put more stress on the patella, on the knee in general. And it could also lead to tracking issues, which is going to further irritate an already cartilageless knee. So the Slumpy Psoas Activator will help you to get the psoas working and to shut off the rec fem. To do this exercise, you sit down, start off in bad posture, hence the word slumpy, and you're going to lift the foot off the ground, flex the hip. You should try to feel that muscle on. It's right around here, not on the outside, that's another hip flexor, but over here. And if you don't feel it too much, you can bring your foot into the middle a little bit, that's external hip rotation. And then from there, place your hand on your knee and you're going to press. And that should fire it up, you should feel it even more. And then once you've got that activation going, get into good posture, stick the butt out, get that curve, natural curve, extension in your lumbar spine, a little bit of anterior pelvic tilt, sticking your tail out, and hold in that position for 5 seconds while you're breathing. Keep that muscle on as you lower the foot to the ground, and you repeat on the other side. So slump down, lift the foot, bring the foot into the middle a little bit, hand on the knee, press, activate, try to bring your mind to that area, and then get into good posture. Straighten up, stick the butt out, pull that leg into the pelvis, holding it for 5 seconds. And then keep those muscles on as you lower to the ground. So that is the Slumpy Psoas Activator. That's going to fire up those hip muscles, and it's going to allow you to use that hip flexor muscle in the next exercise. The last exercise I'm going to show you today is the hip and foot focused squat. So we just woke up the intrinsic foot muscles. Those are the muscles that help you to do the short and skinny foot exercises. They build that arch, and we activated the psoas. Now in the hip and foot focused squat, we're going to use those things in a normal squat movement pattern. What I want you to do before we get into that is just to consciously activate the glutes. And to do that, just stand here, fire up the glutes, hold it for 10 seconds, and make sure your knees aren't turning out so that we get good glute activation. And what you should notice, especially if you don't let your knees turn out, is you start to feel some activation in the front of the hip too. The psoas is there, the adductors there a little bit. Those muscles are going to fire up. And we want those muscles all to be on for the squat. So then let it go gradually. I always like gradual activation, gradual release. Helps us to develop better control of our muscles in our body. And then you could do also a little short and skinny foot. You do both sides now at once because by now you should have woken it up. Just activate and then let it go. Let them relax. So for the hip and foot focused squat, start from the ground up. Start short and skinny foot, and we don't want 100%, maybe 50 to 80% activation down there, just so that those muscles are on. And then what I want is that glute activation, which will help to co-contract the psoas that we already activated in the Slumpy Psoas Activator. So glute activation, foot's on, again, the glute's on 50 to 80%, somewhere around there. From there, keeping good posture, just like a squat, any squat that we would do, keep the glutes on, keep the foot activation, squat as low as you can, maintaining the foot and maintaining the glutes and the front hip. So if you can get down, keeping those muscles on, then do so. Keep neutral spine, good posture. Arms in front helps you get a little more depth. And let's say I'm there, come back up. Nice and slow. See how slow I went? It's because we want to build the strength and this activation pattern throughout the full range of motion. No momentum. We want to make sure those muscles stay on the whole time. And then relax everything. And go again. Foot starts with the feet. Fire up the glutes. Front of the hips on. All this stuff is on. And from there, you go nice and slow, because then you could feel the range where it's let's go. maybe your hips let go, maybe your feet let go. But wherever that range is, stop just short of it. So let's say it's here. I'm going to stop there, and then I'm going to come back up, keeping everything on nice and tight, all the way up, and then gradually let everything go. As you do this over time, your range of motion is going to increase where you're able to keep those muscles on. And that's how, when we have glutes on, hips on, we got feet on, there's going to be less needed from the muscles around the knee, like the quads, the hamstrings. Less muscles or less activity is needed in those muscles, and that's going to decrease the amount of stress that goes through the knees, helping you to keep your knees a little bit more pain-free as you go. So that is the hip and foot focused squat. Do that for 2 sets, anywhere from 6 to 10 reps. If you can do that, good range, you can hit 2 sets, you can do 10 reps, start to add some load. Hold a weight right in front, a goblet, squat, little dumbbell right here, and then just load it up. Because the more we can build the strength in the feet and the hips to control the squat, the better it is and the less stress that'll go through your knees as you do your activities, play your sports, or just go through your everyday life. So those are 5 exercises to give you an idea of Dr. B and my approach to dealing with bone-on-bone knee pain. If you like those, you might like these other videos up here that give you some more ideas and some more exercises. But if you're ready to follow a structured, comprehensive approach to knee pain, check out the Knee Pain Solution and sign up. This program will walk you through all the concepts that we talked about here, but in more depth and in a progressive fashion, so that your knees stay as healthy as possible for as long as possible.